Today we're going to talk about carpal tunnel syndrome and the ultrasound guided carpal tunnel release procedure. This model demonstrates quite nicely the anatomy. We make a tiny puncture wound here in the wrist, and this device goes into the carpal tunnel. So the carpal tunnel is formed by the transverse carpal ligament and the carpal bones underneath. Superficial to that, we have the superficial palmar fascia, which we try to preserve. Once again, you can see that fascia. And this device goes in through a puncture wound, and under ultrasound guidance we place it underneath this ligament and cut the ligament using this device. Are you getting any pain there, or are you pretty good? No pain at all? Excellent. It decompresses the carpal tunnel. The carpal tunnel is the space formed by the transverse carpal ligament as the roof, and the carpal bones form the floor of the carpal tunnel. And that releases the carpal tunnel and takes the pressure off the median nerve, so the blood flow returns to the nerve. Again, staying away from the nerve there, and then sliding the device. P1, thanks. And we're hooking it onto the end of the ligament there now. And there it is there. At the end of the operation, we've preserved the superficial palmar fascia, which lies above the transverse carpal ligament. So when we cut that ligament, we actually preserve this tissue here, which sits beneath the skin and the fat and actually acts as a splint. And then that enables the patient to rehab after the surgery because we preserve that. The really cool thing about this operation is that we can preserve the superficial palmar fascia whilst dividing the transverse carpal ligament. And that enables us to release the ligament but maintain the superficial palmar fascia, something that can't be done in open surgery. So at the end of the operation, we've preserved your skin and your fat, as well as the superficial palmar fascia, which allows you to use the hand quite quickly after surgery. And the recovery is up to 5 times faster than traditional surgery. Band-aid, so they can use their hands straight away. And that Band-Aid just stays on for 2 or 3 days.